You're going to feel a little bit of a stick, and I'll tell you when.
Intravenous or IV therapy is used to supplement or replace body fluids by direct infusion into the peripheral circulation. As a nurse, you play a key role in IV therapy by initiating the infusion according to the physician's orders, monitoring the patient's response, promoting the patient's comfort and mobility, and maintaining continuity of the intravenous line. The skills presented in this program include initiating a peripheral IV, troubleshooting intravenous infusions, and discontinuing IV therapy.
Stick this under your tongue for me for a minute.
To help you place these skills into context, you will meet two patients. Jeff Schwartz is being prepared for an emergency appendectomy. The doctor has ordered IV therapy to be started so he can receive an initial dose of antibiotics before surgery. You will be starting the infusion the doctor has ordered and monitoring Mr. Schwartz's response to therapy.
When did your stomach start to hurt you?
5 or 6 hours now.
Okay.
Melissa West has been receiving analgesic medications intravenously for 2 days as part of her pain control following surgery for an ectopic pregnancy. Her pain has been stable for the past 24 hours, and her doctor is discontinuing intravenous medications. As Mrs. West's nurse, you will discontinue the infusion and document the integrity of the infusion site and catheter when it is withdrawn. Remember, as you administer IV therapy, you need to apply infection control measures, adhere to the 5 rights of medication administration, monitor the patient closely to prevent complications associated with fluid and electrolyte balance and with the intravenous infusion, provide patient education, explaining the rationale for therapy and how the patient can avoid disrupting the IV, apply critical thinking in decision-making and evaluation of the effectiveness of nursing care. Also, remember that care and compassion for the patient's experience are equally important as the patient copes with the discomfort and reduced mobility of intravenous therapy. Initiation of IV therapy traditionally has involved the use of sharps. However, since Congress passed the Needle Stick Safety and Prevention Act in 2001, safer medical devices have been developed and must be used when feasible. Examples include sharps with engineered sharps injury protections, such as sliding sheets that cover needles after use, needles that retract into syringes, and needleless systems with non-needle connections and ports. Be sure you receive training on the use of each and explain necessary precautions to assistive personnel who may discard syringes in times of emergencies. The skills of initiating, managing, and discontinuing an IV cannot be delegated to assistive personnel. However, because assistive personnel work closely with patients during the routine care, it is essential for staff to know what to report when problems arise. Instruct staff to inform you when a patient complains of pain at the IV site, there is apparent leakage of fluid from the IV, or the IV infusion alarm sounds.